Good afternoon, everyone, and thank you all for joining us this afternoon. I'm John Rolfe, and I'm the President and CEO of the Wichita Regional Chamber of Commerce. And I want to welcome you this afternoon to Moving Forward in a World with COVID-19. First, I want to give a big thank you and shout out to our friends at the Sedgwick County Health Department, our co-host for this event this afternoon. The Health Department has offered numerous resources to businesses and individuals throughout COVID-19, and we really appreciate all that they have done to help educate and inform our community about this disease. As we know, COVID rates are low, and the Centers for Disease Control and Prevention has said it's okay for us to all take off our masks. But we know that COVID-19 is definitely still here and present in our communities. So as business leaders, we need to know what it means to move forward and to carry on our businesses with COVID. Today, we're going to hear from three experts on what to expect. We'll have Adrienne Byrne, who has served as the director of the Sedgwick County Health Department since 2014. And prior to becoming director, Adrienne worked in the areas of health protection, health promotion, and children and family health. Adrienne holds a master's degree in community counseling and a bachelor's degree in psychology from Kansas State University. We'll also hear from Kaylee Hervey, who is the epidemiology program manager for Sedgwick County Health Department. In this role, she monitors infectious diseases throughout Sedgwick County. She oversees mitigation measures and analyzes health data. She leads a team of disease investigators who have conducted more than 120,000 disease investigations for COVID-19. Kaylee is a graduate of K-State, or I should say Kansas State University, with a master's degree in public health, infectious diseases, and zoonosis. Dr. Gerald Menz is the Dean of KU School of Medicine, Wichita, and Sedgwick County's local health officer. Dr. Menz is a 1976 graduate of KU School of Medicine, Wichita, where he also completed his residency in internal medicine, followed by an infectious disease fellowship. He joined the school's faculty in 1980 and currently serves as a professor of internal medicine and the associate dean for academic and student affairs, in addition to his role as dean. Once our panelists have spoken, we will have time for questions and answers. Please leave your questions in the chat in the lower right hand of your screen, and we will answer as many of those as we can as time allows. We do hope that we'll have time to answer all of your questions, but we do want to hear from these three experts and their comments on moving forward in a world with COVID-19. So Adrienne, you're up first, and I'll turn it over to you, and thank you for joining us this afternoon.
Thank you. Good afternoon. Adrienne Byrne, Sedgwick County Health Department Director. And I do want to thank the Wichita Regional Chamber and everyone in attendance for giving us this opportunity to talk about our public health response. So the focus of our presentation today will be to update you on current situations with COVID-19 and to provide information on our plans for moving forward. So looking back at where we started with COVID-19, the disease first appeared in January 2020 in Wuhan, China. March 11th, the World Health Organization declared COVID-19 a pandemic. The first case in Kansas was identified in March 7th of 2020, and on March 16th, Sedgwick County limited public gatherings over 50 people, and that was the first of several health orders to come. On March 20th, we identified the first positive case in Sedgwick County. March 25th, Sedgwick County had a stay-at-home order, and the pandemic began to have widely felt consequences. Changes in the way we all lived. It affected everybody and had huge and sometimes devastating economic impacts on local businesses and local owners. Next slide, which is 4. So the COVID-19 impact by numbers. Over 1.2 million tests have been administered and confirmed in Sedgwick County, and this is by all testing partners. We know through this that 1 in 4, or approximately 23% of Sedgwick County's 515,000 residents have tested positive for COVID. But we also know, due to the wide availability of home tests, that the number of Sedgwick County residents that have actually had COVID is much higher than that. Next slide. So our response at Sedgwick County Health Department has focused on several things. One is testing, and our staff at Sedgwick County Health Department, along with temporary staff that we hired, that we are approaching over 100,000 tests that we have administered. We conducted, as was already mentioned, over 120,000 investigations, disease investigations, and provided isolation and quarantine guidance to schools, businesses, individuals, and partners to mitigate the spread of COVID-19. We have provided over 290,000 vaccinations, which drastically reduced severe illness, hospitalizations, and death, and have kept the public informed with current data on case numbers and prevention measures. Now, we have given about 40% of the vaccinations in our county at the Sedgwick County Health Department sites. And many of you may have gotten yours at whether it was the Interest Bank Arena or the Extension Center, or where we were in the last several months at our Mass site at the old Wichita Library on South Main. You may have viewed the COVID-19 dashboard to monitor community levels, or visited our website to keep up to date on changes in guidance for quarantine and isolation. And as everyone knows, it changed all the time. All the information, including quarantine and guidance, quarantine and isolation. So next slide. So where do we go, or where are we now in our response? Depending upon who you ask, that response will probably be different because of businesses, areas in Sedgwick County, and families being impacted to different degrees. Some may take much longer to recover. From a response perspective, we are moving from mitigation and stabilization phase, which is the yellow, mustardy yellow at the bottom of the cycle, into recovery, which is the light brown. From a pandemic response standpoint, the volume of mitigation efforts have reduced greatly. At one time, we were vaccinating, it was a short period of about 4,000 a day. And other than that, during our busiest time, it was at least 2,000. And at this point, we are vaccinating only through mobile clinics, and those average maybe 50 a day, have been as much as 150 a day. And we are continuing to give vaccine at our West Central location, have up to 25 appointments available. The vaccines have helped stabilize and greatly reduce many of the worst outcomes in hospitalizations and death. Dr. Mins will mention some of the treatments that are helping to reduce the worst outcomes. And then we at the health department are taking steps to reach out to business community and the larger community to build more resilience and to strengthen our relationships. Next slide. So where do we go from here? One of the steps that we've taken, again, to strengthen the relationships and to help build resilience in preparation of the next pandemic, because there will be another one, was to hold a community-wide meeting on April 12th of this year. More than 80 people attended from a multiple of private and public sectors. The focus on that day was to identify improvements needed for future public health disaster response, not only from the health department, but also our community partners, and then to plans for improving our response as a community. The next slide. So the needs that we identified on that day were to improve bidirectional communications before and during a disaster, to develop improved community response plans, to provide public health response training, to provide information on all that we do in public health, and to build on and strengthen relationships forged during the public health, during the COVID-19 response. Next steps, we'll have focused meetings to begin developing action plans on the priority items identified, and we're going to be holding that later this month. And one of the outcomes that we know of, that we're going to be having a committee, developing a committee where the various sectors are represented, and to meet once or twice a year so that we can stay connected in those relationships and to review any response or partner updates. Partnerships are key to having a really successful community response, and we know that, and that was definitely reinforced during COVID-19. So next, Kaylee Hervey will talk about declaring COVID endemic, which means living with COVID-19 in the community. And for us in public health, it's learning what managing COVID-19 looks like with the ups and downs that it has and our community needs along the way. So Kaylee, I pass it to you.
Yep. Thank you, Adrian. And thank you again to the Chamber for allowing us to speak with you today and for everyone who is listening. So my name is Kaylee, and I'm the Epidemiology Program Manager for the Health Department. And as Adrian said, I'm going to talk a little bit about kind of the epidemiology and what goes into being endemic. So next slide. So first, I want to start out with some definitions, as those words are really discussed a lot in regards to COVID-19, but you may not know what they actually mean. So endemic is a baseline level of a disease, or basically a constant presence. So it means that the disease exists in our community at an expected level all the time. An epidemic occurs when we see a sudden increase in the level of disease, kind of above that expected baseline. And finally, a pandemic is an epidemic that crosses national borders. And it's also important to note that a disease does not have to fall into one of these categories. They can go through multiple levels, and that can be a regular occurrence. For example, the flu is technically endemic most of the year, but we see yearly epidemics during flu season, and we do occasionally have rare pandemics, such as the 1918 pandemic or the 2009 H1N1 pandemic. Next slide. So I want to start with a little bit about where we are now from a different perspective than what Adrian addressed. So next slide. So this graph shows our current daily number of new cases in Kansas. And so as you can see from the rolling 7-day average, or that orange line, right now in Kansas, we're seeing kind of sorry, my light just went off, a slow increase in cases weekly or daily on this one. Next slide. So this graph is from Sedgwick County. And so it shows Sedgwick County residents who have had COVID-19. And this is by week. So it has a lot of great information on it, but I want to take a second to explain it because there's a lot on there. So this graph, the line on here shows the PCR confirmed cases in Sedgwick County residents by week. So that doesn't include antigen tests, doesn't include at-home tests, just those PCR confirmed. The green area on this graph indicates the threshold for the 5% positivity based on current testing rates. And so that's why it kind of fluctuates. When there's more testing, that green line will be a little bit higher. When there's less testing, it's going to drop a little bit. And what that green line really shows is that if we are in the green, then we are doing pretty well as a community with COVID-19. However, if we are in the red, which is where we are now, then we have a level of COVID-19 in the community that indicates that there might be a higher risk for transmission. And so people should start considering their own personal mitigation measures, such as wearing masks. So if you remember back to the graph we saw for Kansas, we're seeing a very similar trend right now in Sedgwick County, where we're experiencing around 500 to 600 new PCR confirmed cases a week and are kind of on a bit of an upward trend again. Now, obviously, we are not anywhere near where we were with some of the earlier waves, such as the Delta wave, the Omicron wave. But as Adrian mentioned, we also know that there's been an increase in at-home testing. And so we're not showing that on this graph. And so we know we're missing a portion of cases out there. Those people are still positive. Hopefully, they're still isolating and following recommendations, but we're not showing them on here. That doesn't necessarily mean, though, that this is a bad graph. What we can use this PCR testing as is a metric to show that if we're seeing an uptick in PCR cases, we are also likely experiencing an uptick in cases of at-home testing or other antigen testing. And so this is a good measure of kind of what is going on in our community, although it may be a little underrepresented. And then I also want to remind everyone that this graph and a lot of other COVID-19 data is still available on Sedgwick County's COVID-19 story map. We still update these weekly. And so you can still use these measures and this data when you're helping to make decisions for yourself and for your family. Next slide. So this graph is from KDHE. It's a little bit crazy to look at, I know, but it shows hospitalizations and hospital capacity in Kansas. So I'm going to discuss this in more detail later, but overall hospital capacity and COVID-19 patients are a key indicator as we determine if COVID-19 has become endemic. For this figure, you can see that the COVID-19 patient numbers, or that red area kind of at the bottom, appear to remain fairly stable, although there may be a little bit of an increase there. Additionally, there appears to be good hospital capacity, which is the blue area of this graph. And so there are available beds at this time. And this graph focuses on adult hospitalizations, but if you're interested, KDG does have one for pediatrics as well. One important thing to note when looking at hospitalizations, though, is that there is a lag typically. We usually see an increase in cases, and then a few weeks later, we start to see that increase in hospitalizations. So although we're not really seeing much of an increase yet with hospitalizations, we could see a shift in hospital capacity if we experience another wave like Delta or Omicron. Next slide. And then the final graph I want to talk about is deaths. So again, deaths are an important metric for determining if a disease has become endemic. Currently, deaths remain fairly low in Sedgwick County. Although again, with this one, it's important to note that deaths must be confirmed by KDHE and can lag about a month or so behind where we are in current time. Another interesting thing that I want to note when you look at this graph is that there's a big difference when you look at deaths pre-vaccination to post-vaccination. So for that winter 2020 wave, we really see, we had 138 deaths in November, 150 in December, whereas our highest point for that Omicron wave is only 118. And so this kind of really shows kind of the impact we saw with vaccinations, and that we didn't experience, although we had way more cases with Omicron, we didn't see the same level of deaths that we had with earlier waves. Next slide. So now that we've kind of covered an overview of where we're at numbers-wise in the pandemic, let's discuss how pandemics end. They all do in some way, but how they end varies. Next slide. So the first way that pandemics end is they essentially just kind of fade away. In this scenario, prevention and control measures, such as isolating people who are ill, quarantining close contacts, and effectively testing people are able to control the spread of disease. One example of this is the SARS pandemic from the early 2000s. This pandemic really only lasted about 1.5 years and was contained with almost 9,000 cases and 774 deaths. One reason this pandemic was controlled is that there is little to no asymptomatic transmission with SARS, making it easier for cases to be identified and contacts to be quarantined prior to large disease spread. So although it is possible that COVID-19 could have potentially been controlled this way, we have asymptomatic transmission, issues with compliance for public health measures, and lack of testing capacity quickly and early on in the pandemic really made it clear that this was not going to be a feasible end for COVID-19. Next slide. So another way pandemics end are through vaccinating and having widespread effective vaccinations. In this scenario, enough people are vaccinated to prevent further disease spread. One example of this is the smallpox. So smallpox has been around for about 3,000 years. It's not really a new disease. And also the smallpox vaccine was essentially the very first vaccination that we ever had when Edward Jenner used cowpox to vaccinate against smallpox. Now, the modern vaccine is a little bit better than that. It's about 95% or so effective at preventing smallpox. And through global efforts, it was declared eradicated in 1980. And it's one of the few diseases that we've managed to eradicate this way. So again, although this method could work for COVID-19, it does take a lot of time and global resources. So the map I have here on the slide shows the number of people globally who remain unvaccinated against COVID-19. And so you can see that the darker the area, the more people that are unvaccinated. And there's a lot of those. And so with large portions of the population remaining unvaccinated, it will be extremely difficult to end COVID-19 through this vaccination method. Next slide. So the last method that for pandemics ending are becoming endemic. What this means, endemic disease, as I said earlier, have reached a steady or a static state. They just exist at a certain presence in the community and have no unpredictable large waves with no hospitals or healthcare crises. One example of a disease becoming endemic is the 1918 influenza. So as I said earlier, this was a pandemic that occurred from 1918 to 1919. This virus mutated to become a little less severe, and we still see descendant strains every year. One example of that was the H1N1 pandemic. So many scientists and epidemiologists believe that this is likely where COVID-19 is headed, and that's kind of one of the reasons we're talking about it today. Next slide. So the big question, is COVID-19 actually endemic? Next slide. So a disease becoming endemic happens slowly, and there really isn't a set threshold when this occurs. So we may not know that we have actually reached an endemic state until that point has passed. However, there are some indicators that show we are moving in that direction with COVID-19, although we may not quite be there yet on a global scale. One indicator is the CDC's move to the COVID-19 community levels, which focus on hospital admissions, the percentage of staffed hospital beds with COVID-19 patients, and new cases per 100,000. This shift from focusing on only new cases and percent of positive tests as a COVID metric indicates that the CDC is moving towards making COVID-19 endemic by focusing surveillance and control measures, primarily on minimizing severe illness and preventing overwhelming the healthcare systems instead of disease transmission. Another indicator that COVID-19 is moving towards endemic are disease waves. After Omicron, we have not yet seen another large spike in illness, hospitalizations, or deaths. Although this most definitely can still occur, many experts believe that there is now a level of immunity in the community that could prevent another large wave like we saw with Omicron. This does depend on a few factors like vaccinations and new variants, but I'm going to cover that a little bit more in a few slides. Additionally, researchers are still trying to determine the acceptable level of COVID-19 transmission in the community, which is essentially the accepted baseline of illness that we have. COVID-19 has not yet established a truly predictable disease pattern like we see with other diseases like the flu. As more time passes, we may gain this knowledge, but for now, it complicates declaring COVID-19 endemic. And then finally, the availability of vaccinations and antivirals also play a role in COVID-19 becoming endemic. Having these measures to prevent severe disease and death also help reduce the burden on the healthcare system, which, as mentioned before, is a key factor in endemic diseases. Next slide. So I mentioned mutation and variants have an impact on this. And so how new variants mutate do play a role in whether this disease can become endemic or not. So we know that COVID-19 mutates relatively quickly, but we can't always predict how it will mutate. Many viruses mutate in a tree-like pattern, so we kind of know where the mutation is likely headed. So you have one strain and it kind of mutates on itself as it goes along. COVID-19, on the other hand, does not really follow this pattern. As shown with this image, the next variant does not necessarily mutate from a previous variant. So the Omicron variant did not mutate from the Delta variant, but instead mutated from another strain of COVID-19 more closely related to the Alpha or Gamma variant. We think this is because COVID-19 hasn't really had enough time to reach the point of continuous tree-like mutation, but we don't know that for sure. The good news is that a virus does not necessarily mutate to become more severe. Mutations are random, and a virus's goal is to survive and be passed on. With this goal, the most successful viruses will often be the ones that make people ill and are highly transmissible. So with that, we have no guarantee that the next mutation we see of COVID will cause less severe illness, like what we saw with Delta and then Omicron. Next slide, please. Another key factor with COVID-19 is how much immunity or protection someone gets from both previous disease and vaccination. Researchers are still learning what it takes to fully protect someone from COVID-19 and what level of immunity is needed for long-term protection. We have seen with both vaccination and previous illness that antibodies start to decrease in the months after either vaccination or that illness occurring. This is the reason that CDC recommends boosters and second boosters for select populations at higher risk for severe disease. Additionally, it is highly likely that we may need regular vaccinations similar to what we see with the flu vaccine. Another complication to immunity and protection is that immunity again is impacted by the variants. For example, studies have shown that someone who had the Omicron strain of COVID-19 really only has immunity against other Omicron strains, not other variants of concern. So if COVID-19 only mutates from the Omicron strain, then this would be a best case scenario for us because more people would already be protected. However, if we have another mutation similar to the change from Delta to Omicron, we may not have as much immunity to the next wave of COVID-19, which would potentially lead to more cases and more hospitalizations and deaths. This is also why the FDA has now recently recommended that vaccine manufacturers focus on creating new booster vaccines based on variants of concern rather than the original strain of COVID-19. Next slide, please. So what can we do to help make COVID-19 endemic and protect ourselves? And next slide. One of the best things everyone can do is stay up to date with any COVID-19 and other vaccinations and encourage vaccine uptake. You can see from this graph that Sedgwick County is currently sitting at 54% of our population being fully vaccinated, which means they've completed their original vaccine series. This is similar to Kansas's 55%, but below the United States rate of 67%. And these numbers also do not take into account the recommended boosters and second boosters for many of the population. Additionally, we should still continue to practice mitigation measures, especially around people at higher risk for severe disease. This includes wearing masks when needed, such as when we are seeing an increases in cases. The CDC's COVID-19 community levels can be a guide for you when determining what precautions you should take related to COVID-19. So we definitely recommend that you continue to watch those as COVID-19 levels change. Additionally, people should still continue to be tested when you feel ill and make sure that you're staying home when you feel ill so that you don't spread either COVID-19 or any other illness to those around you. Another important step for this method is to use of the antivirals. So these antivirals, and Dr. Menz, I believe will talk about it later, help prevent severe disease when taken early after symptoms begin, which in turn can help alleviate the stress on the healthcare system. Next slide, please. So I really just want to leave you with a few key points because I know I presented a lot of information that some of it was technical. So I want to give you the few key points to end. Next slide, please. So first of all, COVID-19 being endemic does not mean that there is no risk, especially to those who are unvaccinated. It also does not mean that things are going to return to exactly how they were before we had COVID-19. With other endemic diseases, we still see hospitalizations and deaths every year. We see deaths from the flu, we see hospitalizations. It's still going to occur. So there is not, endemic doesn't mean no risk. We also may have to continue to use mitigation measures. That includes masks, when we see waves, especially if you're around people who are at higher risk. It's also important that you evaluate your own personal risk for yourself, for your family, for those around you, and follow recommendations from the public health and from your healthcare providers. And finally, we still need to encourage vaccinations and vaccine uptake, including boosters as they become recommended or we receive new boosters. We are also still needing to increase vaccinations on a global level, as we have all seen how variants can pop up anywhere across the globe. These variants are more likely to gain a foothold among those who are unvaccinated, which is only one reason that vaccination is a key component of making COVID-19 endemic as a disease. So that concludes kind of my portion of talking a little bit about the epidemiology and making COVID-19 endemic. So I'm going to turn it over now to Dr. Menz to let him provide you some additional information. Thank you.
Thank you, Kaylee. I'd have to start out by saying, after these two very academic and complete presentations, I'm not sure there's a whole lot more I can add. So I didn't produce slides since I knew that the previous slides would cover most of the important things I would have to say. So I'll just add a few more comments. I don't know that for the public, the word endemic really has much value. It's a public health issue. It's used for academic purposes. And I think it may give misleading messages to the public. Indeed, we are fortunate that we were able, because of research over the last 10 years on vaccines, that we were able to develop a vaccine against this virus in less than 1 year. That is miraculous. And we are so fortunate in this country that our country was the leader in developing that. As a matter of fact, the physician who was instrumental in developing one of the two vaccines was actually a KU graduate who did some of his training here in Wichita. That vaccine has been very effective in reducing the likelihood of dying or being admitted to the ICU in the hospital. However, one thing I'd like to emphasize, it has not, to our knowledge, reduced the likelihood of getting infected, meaning asymptomatic infection or just a mild infection. There is a lot about this virus and the person's response to it that we are still studying and trying to figure out. This virus is brand new. We hadn't seen it before. We're still learning. We don't have all the answers. We are still learning how the virus infects people and what makes people more resistant to infection. We have now enough experience to know that just because you've been vaccinated does not mean you cannot get the virus into your nasal passageways and potentially transmit it to other people. It does prevent serious illness and death very well. But you can still get it and transmit it to others despite being fully vaccinated. There is still research going on in different vaccines. Hopefully someday we'll have a vaccine that prevents people from acquiring it and carrying it asymptomatically and transmitting it to others. But we're not there yet. One thing I want to emphasize is this virus is constantly undergoing mutations. These viruses only mutate when they're infecting a person or an animal. They cannot mutate outside the host. And they mutate more quickly when large numbers of people are infected. And right now, that means they are mutating faster, mainly in the countries that have low vaccination rates and very high infection rates. And we are now a global world in terms of transportation. These variants are spreading quickly to the United States. Unfortunately, we're not seeing increased hospitalizations or death because of that, but we will constantly see these new variants coming in from other countries where the virus is still rampant, causing many infections in large populations. So it's not like it's static. What we have today is what we will have forever, and it's just a matter of the current viruses we have in the United States mutating. Other viruses in other countries mutating and then coming to our country by travel. As was mentioned, in addition to the vaccines, recently some medications were developed that appear to inhibit the virus once you take them. Unfortunately, the medications have not worked out as well as we hoped. There's two of them. One of them is really not very effective, maybe only 30% effective. The other is probably 70 to 90% effective. However, the more effective medication initially was not readily available due to supply issues. Secondly, it has side effects that we have to be careful with, and it inhibits other drugs you may be taking. So it requires an assessment of what other medications you're taking and whether this drug will interfere with them. It also potentially has side effects, and we're still not clear what the appropriate use is. We're still learning about that. So I would say that the two medications that have been developed are not huge game changers at this point, but I know that there's other drugs being developed, and hopefully we'll have some better drugs that don't cause the side effects and the interference with other medications people may be taking. I agree with everything you've heard in the previous two presentations. Whether we're entering the endemic phase or not probably isn't the most important thing at this point. The important thing is the virus is still in the country. It had gone down to a very low level, and then in May we started to see the numbers go up nationally as well as locally. It has not reached the level we had last January, thank goodness. But we don't understand this virus yet. It isn't behaving like most of the respiratory viruses, which tend to be more seasonal, occurring more in the winter months. But this virus has not followed that pattern ever since it arrived. So I want to emphasize, everybody, we're still learning and studying this virus. And hopefully in the next few years, we'll know a whole lot more about it and can make better advice about how to mitigate its transmission as well as keep the infection rate, the disease rate low. So I'm trying to distinguish between infection and disease. You can still get infected with it, but fortunately it prevents disease symptoms and bad outcomes because of our vaccines. And I also need to mention that previous infection with the virus, even without vaccination, probably leads to a significant degree of immunity, but we haven't had time yet to determine how durable the immunity is, either to the vaccine or to natural infection. We know that it's pretty durable to the length of time people have been vaccinated, particularly if they got the boosters and the fourth dose, if they're eligible for that. But we don't know long-term how durable it is. For instance, we know that the childhood vaccines you got back when you were entering school, measles, mumps, polio, tetanus, pretty durable. We don't have to take a new mumps vaccine every year. We don't have to take a new measles vaccine every year because the disease is very rare. There's not much of it being transmitted, but our immunity is pretty good. This vaccine probably is not going to be that durable. It's somewhat like the flu vaccine. It provides some protection long-term, but probably not as good as we'd like. So I suspect that we are going to be taking boosters at some interval of time. And I think it will be important for people to accept the vaccine as a legitimate way to keep our public healthy. So I think I'll end at that point and be happy to take any questions people have. Probably questions are more important than me just expanding further with more academic aspects of this virus. Thank you for the opportunity to discuss this with you.
Thank you, Dr. Mans. And, you know, you can always talk more academic so I can get smarter. I'll always appreciate that. Or I can act like I'm more smarter after hearing from you. But Dr. Mans, Adrienne, Kaylee, we want to thank you so much for sharing those comments about this COVID-19 and what we are looking at, what we're facing, what businesses, you know, certainly should be considering as we go forward and look at this pandemic / endemic, or however it is termed at whatever given time. So I do want to thank you like I said, I've certainly learned a lot of new things, and I'm sure others have as well. Now, to your point, Dr. Mintz, about answering some questions from our audience, there are some questions that have we've been capturing those, and one of the questions, and I believe, Kaylee, this was based off of something that you had mentioned, but who determines the acceptable level of transmission in determining a virus is endemic?
Yeah, I can answer that. And if Adrian or Dr. Mins, if you have anything to add, feel free to jump in. But really, it's not like one person, one organization that says this is it. It takes a lot of effort and collaboration between various scientists, researchers, epidemiologists, kind of all across the globe, looking at the patterns of COVID, what it's doing in your own country, because it may be that it becomes endemic somewhere before it becomes endemic everywhere. So it's not necessarily all going to happen at once. And so it's a lot of kind of global collaboration of looking at those patterns and looking at populations and trying to just kind of make a determination that this is going to be the point where we call it endemic.
Thanks, Kaylee. I appreciate that. I want to make sure Adrian or Dr. Mintz didn't have any additional comments on that. Next question is long COVID less likely among the vaccinated?
That is a difficult question. Since we know you can still get a mild infection even if you're vaccinated, it's possible to get long COVID. And I have to hedge on that since we don't really understand what long COVID is. We don't understand the mechanism of it. We don't clearly understand how it's related to the initial infection. So I think the jury is still out on that. And there's lots of researchers and academicians studying this intensely because we need to understand this better. We know that people who have a bad flu episode can have lingering symptoms, but this virus seems to produce something a little unique that we're calling long COVID, and the manifestations of it are quite varied. For some people, it's just fatigue. Other people, it's mental fogness. Other people, it may be neurologic syndromes. I've talked to some of the doctors who take care of rheumatologic problems, inflammatory conditions, and they seem to think there's a higher incidence after you've had COVID. So I'm sorry, John, I wish we had more answers, but there's still a lot to learn about this disease.
That's okay. We know we're continuously learning about this, and certainly we appreciate your response to that. There was a question about is there a difference between the variants in the development of long COVID?
I'm not aware that there is, but again, part of the problem is the Alpha and the Delta strain essentially vanished.
Okay.
And now Omicron is essentially the only one we're seeing. So we don't even have a lot of patience to do thorough comparisons between the previous variants and this variant. But again, I think the jury's out on long COVID. A lot of, you could ask me 10 questions about long COVID, and I'm probably going to need the same response.
Right. Well, thank you so much. We certainly appreciate that. Next question is, do we have a sense of the continuing impact on local hospital staff?
Well, I'll help and answer that. And if Kaylee or Adrian wants to add in, that's fine. It has had a major impact on the delivery of healthcare in our community and nationwide. I can tell you the staffing level of both the two major hospitals in our city are not back to where they were pre-COVID. The COVID spike was very difficult for the hospital staff. They were working long hours and continuous hours trying to take care of dying patients. And emotionally and mentally, it was very hard on the staff. And we've had a lot of staff who've left the profession, nursing in particular. We don't know how long they're going to be out, but a number I need a break. Right now, I believe if you ask both of the hospital CEOs, they would say they need more nurses badly. And because of that, I think they're having to watch their bed capacity very closely. It's not so much a matter nowadays of space or beds. It's a matter of being able to staff those beds so they can adequately take care. But that's not just Wichita. Across the nation, it varies somewhat from city to city, but many hospitals are struggling to find enough people to staff their beds. So it remains to be seen what the long-term effect of this epidemic will be on hospitals and other healthcare providers.
Thank you. Another question was, being that more home tests are being encouraged, how do we capture data to make the overall picture more accurate?
Kaylee's the data capturer, so I'll let her answer that.
Yeah, so when you get a home test, it should come with some kind of instructions that say download this app and you can report your results, positive or negative, to that program. If you do that, we do actually get that information from this. Well, the state health department does through a reporting process. And so I think the biggest way to encourage people, if you're doing a home test, is to make sure you're reporting those results. And that would help us have a more accurate picture, because most people I know don't do that. They probably don't even read that part of the results. They just look, it's positive, it's negative. That's fine. We do on our website have a reporting, it's a form you can download and fill out and email back to us, and we will enter that information into our system. So if you aren't able to download the app for some reason, we do have that option for people. And so we really just encourage you to make sure you're reporting those results to us. And that would be the best way for us to capture that data.
Thanks, Kaylee. What should a business do when an employee tests positive for COVID-19? And then I'm going to just add to that, because it was two parts, but what are the latest quarantine/isolation guidelines for the employee and anyone who was possibly exposed?
I'll take that one as well. So it depends a little bit on what your business does. But for most of the businesses, I'm going to guess on here, you're not healthcare, probably. You're not falling in that. So if you are, feel free to reach out to me afterwards, and I'd be happy to answer those questions. They're a little more complicated. But for most people in the general public right now, the isolation guidelines are for someone to isolate at home. And by that, I mean away from your family, away from anyone else in the household, for 5 full days from the onset of symptoms. Or if you do not have symptoms, from the date that you sampled yourself. So if it's an at-home test that day, if you went to the doctor the day they sampled. And I say 5 full days because whatever that day is, that's going to be your day 0. So you'll start your count there. And after those 5 full days, if your symptoms are improving, if you are fever-free for 24 hours without using medication, then you can return to normal activities, return back to work, with the caveat that you must wear a well-fitting mask at all times for an additional 5 days. And so that is kind of the crux of that, is you have to be able to wear a mask. If you can't wear a mask, then you need to stay home for the full 10 days. For the people that are close contacts, and that definition is still within 6 feet for 10 minutes or more, they would need to do something depending on different factors. If they are up to date on vaccination, and that means that they have all of their primary series plus any recommended boosters. So if they're over 50, then they would, and qualified for a second booster, they would need to have that to meet this criteria. Then they are considered to not be susceptible and would not need to quarantine, but should monitor for symptoms for the full 14 days after last exposure. If that person has had documented COVID in the past 90 days, it would be the same scenario. They would not have to quarantine, but should monitor for symptoms. And if you develop symptoms, you would need to be tested, go home and get a test. If you don't meet that criteria, then you would need to do a very similar process to isolation. You would quarantine at home for 5 days. And then if you do not develop symptoms or test positive during that time frame, then you could return to normal activities, but again, must be wearing a well-fitting mask for the rest of that 10-day period. So if you can't wear a mask, then you would need to stay home. And we would recommend that you get tested on day 5 before you left quarantine. But it's not a requirement, but it is a strong recommendation for that. And I will say, because I know that's a lot, that that is also on our website. And so when you go to our website under the health department's COVID page, there is a link to isolation and quarantine guidelines, and you would just select the general public healthcare, or if you're a congregate setting.
We're going to have a test on that, and everyone that's online is going to have to answer it correctly before they can disconnect. All right. Kaylee, that was very helpful. Thank you very much. Wow. To hear, to know all those details is so important. So I'm so glad we have individuals like you who are tracking this and can help us when those things come up. Next question, what new variants are on the horizon and what impact might we expect as fall approaches, if any?
Well, we can't predict the future, and I'm sure we'll see some variants that have changed enough to even change the name, maybe. When we had the Delta strain, the Omicron strain, it was different enough, we gave it a new name. Some of the Omicron, we've actually had a number of new strains of Omicron, but their genetic makeup has not changed as drastically as it did from Delta to Omicron. But even within the last 3 or 4 months, we've seen some new strains of Omicron come out, and their transmissibility seems to be different than the parent strain. So this is a very complex field of study. I think all of us anticipate there will be new strains coming out, where there'll be an entirely new strain that we give a different name to, or just call it a variant of the Omicron. Most likely, both are possible.
Great. Well, I know, go ahead, Adrienne, I'm sorry.
You say with fall, it's always difficult, but we tend to get into flu season. The last 2 flu seasons have been unusual, in part because people were used to preventive measures of distancing and masks, and so there were very, very, very few. I think more of the community have put preventive measures aside now. But we're still, as Dr. Menz has been saying, we'll have to wait and see what happens. But it's typically when school starts, kids are back inside, closed, in closed areas, that flu begins to increase. But it's a question mark what we'll see this year.
All right. Thank you, Adrienne. We have time probably for one more. We might be able to get 2, but one more question. Is the Paxlovid drug effective and available to all?
Well, in the studies that led to its approval, the research that was done that led to its approval by the FDA showed that it was effective at a pretty good rate, 70 to 90%. Now, available to all, well, it's not cheap. And as I mentioned, some people are on other medications that contraindicate the use of the drug in them, unless they can stop those other medications. So I would say the availability has not been as successful as we had hoped. And I hope new drugs are in the pipeline that don't have the conflicts that this drug has, so that and it's easier to take. So.
Thank you, Dr. Menz. I think we have just time for one more quick question here. The molecular, I believe it's Molecular Diagnostic Lab, or the MDL, has been a lifesaver. How long will free testing remain available?
What we are aware of is through the end of the year.
Okay.
And then we also offer testing on a much less amount, about 15, 20 a day at our West Central location. But MDL, we hear, is through the end of the year.
Okay. Would the panel be willing to offer best practices for businesses that provide in-home services?
They provide what, like in-home services as far as like nursing services, or?
I wasn't real clear on what they were referring to on that. And we may have to try and get more information from the person who put that in the chat box. But I'm assuming that provide in-home. I have to admit, I'm not clear on that, Adrian.
And
I can't answer that completely. Adrian, I'll give it a try and you can take it. The vaccine is not as protective for people who have severe illness or chronically ill, have serious other underlying diseases. Their body just doesn't react to the vaccine as well as in people who are healthy. I would suspect that many of the patients that need in-home care are in that classification. So I would certainly suggest that if you're providing in-home care, a mask should be worn, even if you feel fine. Some people have doubted the effectiveness of the mask, but as was alluded to earlier, both years we saw much less flu than we are used to. And I think most of the scientists attributed that to the frequent mask wearing that was going on those 2 years.
Ask that one.
Adrian, do you have anything to add?
I don't, Dr. Mintz.
That's additional information on that. Their dog trainers working.
Well, I know we are at time, and we do have a few more questions. There were a few more questions that we didn't get to, but I want to thank everyone that was able to join us this afternoon, and we will try and somehow get some of your questions answered and get that to you, or put this, I believe it will show on our website. So we will have this on our website as well. I do also want to thank Dr. Mintz, Adrian, Kaylee. We so appreciate you taking time to share this information with the online viewing audience. I also want to thank you and your team for making this happen. I know Bill Kuzer is on the line as well. Bill, we thank you. And I also want to acknowledge our team that are behind the scenes, Lisa Dill, Angie Elliott, and Chelsea Dyer as well, who are running things that you might not be able to see, but I can see that's happening and making this all happen and made it happen today. So thank you all. Again, we so appreciate your time, and we look forward to perhaps having another update in the near future on this topic. You all have a great afternoon and enjoy the rest of your week.
Thank you. Send us any questions and we will answer them.